Hello there, and welcome to my futuristic lab, a space where innovative insights meet practical care. I'm Robo, your guide on an extraordinary journey into reimagining patient outcomes. Today, we'll step into a holographic exploration of the human body to uncover the intricate mechanisms at work. Ready to unravel some secrets? Let's go! In a world where unseen connections can dictate life's outcomes, CRM complications weave a story of intertwined challenges, where the heart, kidneys, and metabolic system are locked in an intricate and complex interplay. These components are tied together by shared risk factors that affects all three alike, including hypertension and glucose metabolism disturbances. Let's delve together into this intricate battle, uncovering a realm where early intervention could spark the change needed to empower your patients, making protection their superpower. Next stop on our journey, brace yourself, we're heading into the kidneys. Chronic kidney disease and cardiorenal metabolic syndrome heightens cardiovascular risk, where it drives fluid retention, inflammation, and vascular damage, worsening hypertension, straining the heart, and raising risks of heart failure in 40% of patients with chronic kidney disease. CKD is often intrinsically associated with hypertension, as hypertension is a strong determinant of worse renal and cardiovascular outcomes, and renal function decline aggravates hypertension. This bidirectional relationship is well documented by the high prevalence of hypertension across CKD stages. When associated with chronic kidney disease, the impact of hypertension on target organ damages and cardiovascular outcomes increases several folds for many reasons. In patients with type 2 diabetes and chronic kidney disease, cardiovascular disease risk is further amplified. Hyperglycemia and kidney decline together cause oxidative stress and arterial damage, accelerating heart failure. It can take years before the effects of diabetes on the kidney are picked up clinically, although the changes start soon after its onset, where 40% of patients with diabetes end up with kidney disease and 10% end up on dialysis. Now let's go back and take a moment to sum up our journey so far and reflect on the incredible discoveries we've made. The heart, kidneys, and metabolic systems form a tightly connected network. As CRM syndrome risks build on one another, they can lead to life-changing complications. The progression from early warning signs to advanced organ dysfunction often unfolds unnoticed, necessitating early and proactive intervention to halt irreversible CRM damage. However, many patients lack recommended renal and cardiac screenings. Assessment of albuminuria and estimated glomerular filtration rate is required for early chronic kidney disease diagnosis, with urine albumin to creatinine ratio and estimated glomerular filtration rate tests performed annually and adjusted based on chronic kidney disease severity. Routine tests like blood pressure and metabolic syndrome assessments remain essential. Now that we learned about the complexities of CRM, you're probably wondering, how can we protect our patients from its complications? Let me take you through the same journey again, but this time we'll have the right tool to make it better. Let's retrace our steps and follow our tiny friends out there back to the kidneys. Jardiance helps preserve kidney function by slowing disease progression and reducing the need for replacement therapy. It shows a 39% relative reduction in worsening nephropathy in diabetic patients and a 28% lower risk of kidney disease progression or cardiovascular death in patients without diabetes. Consider the difference that early intervention makes. Initiating treatment when kidney function is severely compromised at an estimated glomerular filtration rate of 20 milli per minute may prevent around 300 hemodialysis sessions, while initiating at 85 milli per minute could avoid over 4,000. Early use not only protects the kidneys, but also greatly improves patients' quality of life. What a journey! Hope you enjoyed it as much as I did. Now don't forget that CRM complications weave together silent threats to our heart, kidney, and metabolic well-being. Routine chronic kidney disease screening with UACR and EGFR is essential to catch early signs of the damage. When we act swiftly with therapies like Jardiance, we can rewrite the narrative, altering disease progression and preserving the promise of a healthier future.